Hello, this is Lisa LaRose here on Connect to Love on PRNFM, and I am beyond delighted. We're so gifted by the presence of so many beautiful people here on this earth, and my co-host, Michael J. Russ, is one of them, and I want to welcome you, Michael, to the show. And I would love to, and I'm just so delighted because we have today a guest who is so special and so near and dear to my heart just because she's an amazing person on the planet and she is a gift to so many people here in this world. And I just want to read something first because it's from an amazing book by Cindy Dale on healing, and it's, what is a healer? All healers are energy workers, but not all energy workers are healers. Curing and healing are very different concepts. To cure is to erase a symptom. To heal is to assure a state of wholeness. A whole person is whole in spite of a missing leg, a flu bug, or a death sentence. A healer essentially is somebody who helps another person realize their inherent wholeness regardless of appearances or the outcome of the treatment. Being a healer involves a code of honor, one that promotes healthy feelings, actions, thoughts, and beliefs in the patient without compromising anything. And I think that is exactly who you are. And I want to welcome, without further ado, Dr. Gloria Kaye to the show. And I'm just going to welcome you first and then just read a little bit about your background so our audience has some idea. But I'm so honored to have you, Dr. Gloria.
Oh, my goodness. Well, it's my honor to be with the both of you today.
Oh, thank you.
Thank you.
So you got your start initially in the 90s in integrated pain management. You are clinical psychology in clinical psychology and health psychology, and then you help people through hands-on healing, and you really realized that you had a gift in your teens. You had a beautiful, amazing Russian grandmother who, I guess, in the lineage, you inherited that gift and that talent, carried on the tradition, but you also brought your own, I guess the word is beauty, to the gift of healing, and you have brought so much forth. I think that what you do, and I really have to say that I admire you. We've been talking this whole year about self-worth and the ability to step beyond what our traditional bounds were. And you did your dissertation on a topic that at the time was not really popular. Am I correct? It was involving yoga, which was not seen.
The first dissertation was yoga and a depressed institutionalized geriatric sample.
Wow.
And I was really ahead of my time, as my mother used to point out to me. And the powers that be, I'll name the university because they didn't treat me well. It was at Temple University. They finally said, we don't like your topic, and this was after everything was signed off. And also the dean said, well, I don't know where this is going to go, but anyway, the dean said, if you quote me, I'll deny it. But basically, they didn't like the topic. So I wound up doing several dissertations. And the one that was finally passed was on yoga therapeutics. And that was out here in California, where I got my doctorate.
Wow.
So it was a hard time in my life, very disappointing. But here I am.
You were way ahead of your time, and the fact that you reached out and saw the value in the geriatric community is just amazing. It's amazing. And probably part of that was because of your gift of tuning in. And I think Michael and I talk a lot about the quantum field on this show and how really things are brought forth in our knowingness, and we have to learn to trust that. And it sounds as though you did. You had tuned into that and really knew that was something that would be of value. And look at where we are now. It's just absolutely amazing. It's absolutely amazing. I had excuse me, I apologize. I started really reading your book, A Healer's Hands, A Healer's Heart, and I am just, there's no words to describe. I want to just share with our audience that Dr. Gloria Kaye is, in her book, she shares that she's able to help over 90% of the individuals that she works with that walk through her door, and it doesn't matter whether they are a skeptic or not. And I think the skeptics keep you on your toes, and I'd love for you to share a little bit of what that's like, because I think for so many of us, when we approach something that is not in the mainstream norm, a lot of us are just dissuaded from really pursuing our passion or owning our truth. And so I'd love for you to share what that is and how you view that and how you've overcome that obstacle.
Sure. Well, currently I am working with a nurse, and her complaint was a frozen shoulder. Well, without sounding like a braggart, I don't know, I must have worked on 100 frozen shoulders successfully. So she Googled me, and mostly people come from referral, and so they know about my work. But she Googled me, and we had a conversation, and she told me about her frozen shoulder, and her doctors wanted her to have physical therapy, and it was very painful to break up the scar tissue, and she just was in a lot of turmoil about which direction to go. So I did one session, and I said, if you do a session, you probably will have an immediate response. Well, sure enough, the shoulder was no longer frozen. She was able to reach for the ceiling. She could reach she could arrange her arm so that it was parallel to the floor. So she had all of this movement. However, she couldn't put her arm behind her, and I didn't want her to. It was too soon. So I was dealing with a woman who came from a medical background, and sometimes that can be difficult.
Yeah.
And disbelief, even though she could reach for the ceiling and extend her arm. And I'm going to do another session with her on Saturday, and I will be able to loosen things up so that she can have her arm behind her. So she wasn't willing to acknowledge the changes, the positive changes, and kept saying, but I can't put my arm behind me. I said, I know, it's not time. Anyway, I don't have that much, I don't know in her case if it was skepticism or just, having that medical background. Sometimes that does get in the way. And then coincidentally, I worked on a physician last week who consulted physicians, had an MRI, did a number of things, and could not get to the source of her pain. Well, I worked on her for an hour, and she was much improved. And then about 5 days later, I worked on her for a half hour, and she was fine. So the energy will go where it needs to go, and that's really critical. My job is to find the point of insertion so that I can get that energy moving in the body. But once it's in the body, it goes where it needs to go. So this physician I was telling you about was quite comfortable. And that was a real blessing for me because she personally has helped me so many times, and I've never had the opportunity to repay the favor.
Oh,
but
that's beautiful.
Yeah.
That's
wonderful.
really beautiful.
Yeah.
Well, I think, too, that's a really good point, that the point, what you're calling the point of insertion, the origin of the pain, is not necessarily where somebody is experiencing that. And I think it's whether it's actual physical pain, sometimes it's caused by emotional trauma that somebody has experienced that they're holding in their body. Do you find that very often in the individuals that you're working with?
I do not. However, coincidentally, I am working with a woman, and not very successfully. I mean, we have a lovely relationship, and she wants to be my friend, and I'm happy to be her friend. But she has had accidents and childhood trauma, and she's actually seeing a therapist now to deal with this trauma because I could only go so far with her. And I realize there are limitations to what I can do. But I'm very fond of her, and it made me sad that I couldn't do more. but she's receiving help elsewhere, so that's fine.
Yeah. Wow, interesting. That's so unique, so unique. Can I ask a question? At what point in your life did you discover you had this gift? I know you were talking about, you mentioned already that in the introduction, Lisa mentioned that your grandmother was an influence on your life. But when did you kind of cross paths with this gift?
Well, let me clarify. It was my great aunt Katie.
Oh, it's your great aunt Katie.
Yeah.
I'm sorry.
Okay.
Yeah, no problem.
Okay.
But very frequently it skips a generation. And coincidentally, my grandson has the gift. Yeah. So it very frequently skips a generation. And my great aunt, I was named after her, didn't realize that I had inherited her gift. And she died before I was born.
Oh,
so
really?
I never got, to experience her or what she would do. But the family story is Aunt Katie would help people, and people would come to her, and then they would feel better. And so I just ran with that. Well, I'm going to call it a myth. But anyway, that's how that happened. And so over the years, and I'm getting to answer your question, I was 16 when I remember being with a girlfriend. I think I have this in my book. And I saw her whole face change. Now, when I say change, I look at structural changes. And at the time when I was 16, I didn't know what I was looking at. But the work that I do creates structural changes. So it releases the tendons and the ligaments that are holding the body in a skewed manner. And so I saw my friend come into balance, and I didn't know what I was looking at, but I saw that she was better. So that really was my first recollection. But even as a child, when I was 5, 6, 7, I know I had a different worldview. I definitely had a different worldview. And my parents were very supportive. That's a
good thing.
Particularly my mother,
thing.
yeah. Yeah.
Mm-hmm.
Yeah. Always encouraging me. My mother used to say, you can cook in whatever language you can read. So she was.
That's really sweet. Yeah. That's really sweet.
Yeah, she was way ahead of her time. Yeah.
We know. I want to just give your website just real quick. It's Dr. Gloria Kaye, KAYE.com, and on that website, and I think there must be relatively new photos from before, but the young man with the spine,
yes.
Spine, I don't think I've ever seen such dramatic shifts it's just amazing, and I'm sure that you gave him a new set of confidence with that. Could you tell us a little bit about that experience, maybe, in working with him and what you see?
Well, first of all, he experienced a birth trauma. Now, his spine was affected by the birth trauma, and it very much was affected. His front spine was affected. So if you look at the pictures, you'll see that the front of his body is very skewed. I do have pictures of his back, but the front is most noticeable, or more noticeable. And so it took a long time, because most sessions, most times I can resolve things, within 3 to 6 sessions, but I took 3 months to make those corrections. So the before pictures are really astonishing, if I have to say so myself.
Absolutely.
He's crooked. He's crooked. And, they were looking at surgery, and he was having difficulty breathing. So, straightening his spine out like that really gave him a new lease on life.
I would say it almost looks as though, too, that he was able to absorb food. I don't know. I'm just from a digestive standpoint, you got everything working better, not just the spine. Because just the muscle tone and I don't know. It's just such a dramatic shift. I'm sure he is so grateful to you, and I'm really glad that you brought up that it's not sometimes it's not in our timing to decide how and when healing is complete or even done. It's not just one session. Sometimes it does take multiple sessions. We're so it's this instant gratification society where we send we used to send a fax. We had to send a letter, and then then we were able to send a fax, and now people can send something over their phone. But really, it's the energies that work through you that determine, and how he receives it, that really make a change. Am I correct in that?
Yes.
Dr. Gloria?
Yes. Absolutely. Yes. Yeah. A very profound experience working with him. Absolutely. Yeah.
That's amazing. It really is. Michael, did you wanted to ask something of Dr. Gloria?
I did actually. I'm on your website, and you were talking about distance healing. You have a section on distance healing, and it would be very interesting for our audience to understand that you don't need to be in person with them for them to experience the benefits of what you do. Could you kind of elaborate on that?
Absolutely. So I've been doing remote healing for quite a while, but since COVID, I really focus mainly on remote healing. And even though, the pandemic is supposed to be over, I seldom see people for hands-on healing. And I'll tell you why. I find it more potent to do remote healing because I can get to places with the energy remotely that I can't get when I do hands-on. That I can't get when I do hands-on. Yeah. So I can give you some examples. Well, for instance, to be very specific, the genitalia, men and women. I can get in there energetically and make adjustments, but I certainly am not going to do that hands-on. No.
I understand.
No.
Highly understand.
And then I've done a lot of dental work, and that also lends itself really well to remote healing because teeth will move, and I've helped people avoid root canals and maybe even shorten. I'm thinking of a child who had really buck teeth, and I worked with him, and so the amount of time that he needed to have braces was shortened.
Wow.
Yeah. So my preference is remote healing. So even if someone comes to me and they want to be in my presence, I usually have them seated at least 10 feet away from me. And I do the remote healing so that we have that distance and so that I can get where I need to go. And, if they still want me to touch them for whatever reason, I will do that. But I just find it so much more potent to do remote healing. And I can do it worldwide. I mean, I just got back from Cyprus.
Of course.
And I treated a number of people there. I treated a number of people in the States while I was in Cyprus. So it doesn't matter if it's 10 feet or 10,000 miles,
Absolutely.
Awesome.
And I just want to share something. Actually, Dr. Gloria, I got to know her through Glenn Brooks, who was the founder of the Vibrant Living Network. And then last year when my little dog, Odin, jumped off the wall and had an injury, I reached out to Dr. Gloria for a session, and she happened to be in Cyprus, and she contacted me. And the experience was nothing short of miraculous. It was absolutely amazing. Now, one of the things with animals is there is no placebo effect. So as I had Dr. Gloria, she was on the phone, and he could hear her voice, most certainly. But as she would describe things as what she saw and what she moved, he would react. And it was such a profound difference because he was not really able to walk after his accident. He had no use. Would you just share a little bit about either your experience with Odin or with some of the other animals that you work with, Gloria?
Well, I like the fact that you brought up the point that there's no placebo effect. And I frequently, well, not frequently, but I've worked with huge horses, 18-hand horses. And how do you negotiate with an 18-hand horse? You don't.
For sure.
You can't. So depending, I've worked on animals with cancers, with hind end issues, with injuries, as you were describing, digestive complaints. I've worked with, cats, dogs, horses, an iguana, birds.
Oh, how fun.
Yeah, birds are very interesting. They are so sensitive. So I have to be very careful when working with birds because they cannot handle very much of my energy.
Oh, that's interesting.
Yeah, they just cannot.
That's unique.
So I don't know if there's anything else I can say about working with animals. I love working with animals. I love the results. And again, I think the remote healing is the more powerful tool rather than hands-on.
Wonderful.
Right.
Let me ask you another question. You what is partner healing?
Oh, are you in my book?
I was reading through it before the show. Yes. But I'm interested in that. It just stood out to me. I'm going, partner healing. Okay, that's interesting. I just want to know what it is in your own words. Describe to our audience what it is.
Just some techniques in which individuals can exchange energy. So that would be partner healing. Now, whether it's going to fix a knee or not, I can't say. But exchanging energy would be, yeah. Exchanging energy is one thing. Fixing a knee is a little more specific, so I can't guarantee that with partner healing.
Good point. Yeah, well, you're the expert. You're the one with the gift here, so it's not like you're able to give somebody else the energy and have them work with someone other than that. That kind of it would seem kind of strange to me. But when you I guess I used to know someone who was in. Actually, I do know someone who was into Bowen, and a Bowen practitioner and teacher,
yes,
and the like. And he would work with soccer players and tennis players and football players whose livelihood was dependent upon their own physical health. And so when they had some sort of injury or whatever, he working with them as soon as possible aided in their process of healing. And I've noticed that you do work with people in the sports field. And the question I have is, to what extent is getting to you as soon as possible a factor in their process of healing, or can it be a period of time before they actually
I'd rather
see
not. Yeah. So I would like to avoid working on a chronic injury. But, supposing it was basketball players mainly that I worked with. And, when they're injured for whatever reason, if I have the opportunity to do a healing with them, they usually respond. So I can get a player off of the bench and into the game very quickly. Okay. And I don't know what very quickly looks like. I mean, I don't need anything other than my focusing on the issue and correcting it as best I can.
Mm-hmm.
But,
chronic... Tangent off it.
Yeah.
Go ahead.
Sorry?
Go ahead, please. Go ahead, please.
A chronic situation may take longer, but not necessarily. Not necessarily if I get the right combination. And, and I trust, this is what happens, Michael. I get a picture. And the picture is as clear as if someone were right in front of me. And I see inside. And I see what's going on. And I can see how people are responding to the energy. So as things start to clear, I'm able to comment on that. So as I mentioned earlier with Lisa, I'm with a girlfriend now, and she had problem with her esophagus a little earlier. And I could see kind of debris, and I'm using that word very loosely, in her chest. And as I worked on her, I saw that clear, and the debris was eradicated. So it just, I think I'll go back to my website. So we have regeneration, we have reconstruction, and we have this eradication. So unwanted cells will be eradicated. Now, I have to answer the question, where do they go? I don't know where they go, but I think there's a kind of alchemy that goes on.
Mm-hmm.
No.
Yeah. It makes sense.
I think that's an important point too. You don't need to know. You, as a gifted healer, as you said, you get an image, and then you have your point of insertion, and that's the beginning point on your journey in the roadmap of somebody's body. And what happens in the transmission of the energies that flow through you, and correct my languaging if it's not flow through you, but I don't know if it's emitting or transmitted from you into that individual. Once you kind of guide them, right? You said you don't need to know where they go. You're sending them on the journey. Do you get a certain point where you sort of get, I guess, a done point? Like this is as
Yes.
far as I can go today.
I will say I believe we're complete.
We are complete.
Diplomatically, I will say I believe we're complete. Is there anywhere else you'd like me to go? And most times people say, no, I'm complete.
That's beautiful.
Wonderful. Is it something
beautiful.
that you feel they can sense when that happens?
Sometimes. You know, it's a sense of completion. Well, in your opening statement about wholeness, you know, the sense of completeness, I think, has to do with wholeness.
That is.
Very true. Very true. And
Very
I
amazing.
think that it's just so powerful and such a gift. I had to chuckle when I was reading your book, because there was one of the young men that had written about said that when he met you, he was looking for, he wanted to know where the fairy godmother wand was and where the sparkles were. I just thought that was
Wonderful.
so delightful, you know, because of how people envision that. Now, you know, in former times, healers were welcomed and honored, and I think you know, really revered in the community, and somehow we have gotten away from that. And a few episodes ago, Michael and I were speaking about perception and dandelions in particular, and how at one time they were considered the elixir of life. And do you think that there's a move more towards now people starting to gain I guess a greater acceptance and wanting to seek out healers more often?
Yes, I would say within the last 5 years.
Within the last 5 years.
Yeah, it's been a significant change, yeah. And part of that, you know, people are fed up with traditional medicine. Like this nurse I was telling you about, you know, she saw an orthopedist. She went for physical therapy. The physical therapist said, well, it has to hurt when we break up the scar tissue. And I said to her, that's not the way I perceive things. And I just don't agree with that. You know, scar tissue can be reduced energetically, and it doesn't have to hurt. So I think people are getting a little more savvy and a little more, let me find the right word, receptive, and they want wellness and they want wholeness. You know, we're living in very troubled times, and I think, you know, the sooner people can feel good physically, they'll be more able to deal with external things, and that's just the way life is.
Yeah, I couldn't agree more with you. You know, I see that so much, and I think too with what you're doing, and whereas a medication sometimes is like putting a Band-Aid on a bullet wound. I always said nobody ever, you know, the body doesn't look for Paxil, or it doesn't look for some of these other medications. You know, we don't have a deficiency of that. There's something that's going on within the actual physical body that needs to be put back into balance. And one of the young people that you worked with was a child that had been vaccine injured and had difficulty,
yes.
With falling and crawling and walking. And could you share a little bit about that journey and how you shifted things for?
Sure.
I think the child's name was Jane. Am I correct?
I may have. That was not her name. I think I used a pseudonym.
That's okay. Yeah, that's okay.
But at any rate, I stayed in touch with her mom. So she's in her 30s now.
Oh my gosh!
Has her own children and is a runner. So
wow.
Again, the mom took her all over, and I think the energy, is the most powerful intervention. That's, of course, I have my bias. But Mom took
I've
her
got shivers all over my arms when you said that. That's amazing.
Yeah. So I worked on this child, and I worked on her spine. And what I did, she was a little one. She was in a little walker, one of those childhood walkers. And I positioned her so that I could work on her spine and she was occupied with some toys. So I worked on her spine. I don't think I worked on her more than 5 or 6 times. But I remember the mom saying, after I worked on her, she got very heavy, very, very heavy. And I don't know if you noticed that with Odin, but a lot of times the animals will get very heavy. Like they'll feel twice their normal weight. And so the mom had difficulty, maneuvering this little child. But anyway, it worked. It worked. And now she's, as I said, in her 30s and a runner and has 3 children. Good
that's
story.
Incredible. Oh my gosh, that's a beautiful
Wonderful.
story. Wow. It's just incredible. Incredible, leaves me speechless, and to have had that blessing to have found you, and that's what's so interesting, because I'm not even sure how Glenn found you. I was so grateful that he did, because we had so many delightful conversations.
We did have good times, yes.
Yes, we did. Most definitely, and and there's so much that you have to share. So most people are finding you now through the medical community, and I hope that they do find you through our show here on PRN-FM. We have
thank you.
An international audience, so you never know where you're going to be getting a call from. It would be very, very nice. Now, I have a question, because Michael has a connection to Hawaii, and I did see in your book that Madame Pele was likened to you because of your red hair, and
yes.
I got such a kick out of that, because they say Pele is seen as a beautiful woman, and I think that you are just that, Dr. Gloria. You just radiate that.
Thank you.
So do you find that you have a connection to, so if you were in Hawaii, do you find that you can kind of gather in the energy? Do you notice at different places on the planet that your energies are amplified or different, or I don't know, you tune into different frequencies, I guess, is how I would put it?
Well, I'm going to answer your question in a roundabout way. I remember being on one of those short flights in Hawaii, and I was sitting next to a man who was a stunt man, and he hurt himself. I don't remember what the injury was. And I said, would you like some help? And so I helped him. And that's when he came up with the idea that maybe I'm Pele. So, yeah. So I just feel like I'm drawn where I'm needed.
Mm-hmm.
And I can't say that I'm drawn to any particular area. I'm drawn to the person. I'm drawn to the person and the needs of that person. That's the way it works, more than locale.
That's beautiful.
Mm-hmm. That's awesome. That is awesome. What an amazing way to practice what you practice.
Michael, I just feel so blessed. I can't tell you. I feel absolutely blessed.
You sound like it. I can sense that you are right here through the phone. Such a wonderful, calming presence you have.
Thank you.
Just in this conversation. That's just what I sense. I'd like to ask you, this is, we talked about healing different things and areas in the body. Have you ever worked with people who have excessive cholesterol or blood sugar issues, balancing issues, or anything of that nature, or we relegated to
the physical pain,
frozen shoulders, and the physical things?
Actually, I've been successful with blood sugar, not cholesterol.
Mm-hmm.
Yeah, so the work seems to affect that chemistry, but not the
Mm-hmm.
cholesterol. Yeah,
that's interesting. That is interesting, and it kind of sounds like it made sense because it's different with most people. Blood sugar is one thing, but cholesterol is different for everybody. However, that I am so impressed, and my mind is kind of always blown when I encounter such amazing people like yourself practicing modalities that are so unique. I've for many decades been sort of an out of the box thinker when it comes to healing, and have myself. And don't be surprised if you get a connection get a call from me, a contact from me sometime here in the next month about my lower back. We'll deal with that.
Oh, sure. Now, Michael,
yeah.
May I interrupt you? I just want to say I'm really easy to get a hold of. And my preference is to have a text or an email, but preferably a text. And unless there's some catastrophic thing going on, I usually am able to get back to someone within 24 hours. But I'm easy to reach.
Cool.
That's the point that I wanted to make. So whenever you're
That's
ready, awesome. I'm happy to do that. Now, if you want a little demo while we're on the air on your back.
That would be wonderful. I think our audience would. And then we can get some
my golf
feedback
game will
from
help
you, Michael.
Oh, sure.
Twist his arm, Dr. Gloria. That's beautiful.
Yeah,
That's exciting.
Please. Yeah, why not?
So you're saying it's your lower back? Does it hurt this
moment?
moment?
I had an L1, L5S1 herniation back in 1989, and I feel that the energy from that, whatever, that just has not really healed. I feel better, but then again, I go out and do things, and it's stressed and strained. So that's where I'm at right now.
Sure. Okay, so I'm going to tell you my process as you're telling me your story.
Sure.
So you tell me that. I see it. I see it. In my mind's eye, I see it as clearly as if it were inside your body. Now, I want to really differentiate. If you were here in front of me, I would be seeing, the outside of your body. But with this sight that I have, I see the inside of your body. Okay. Mm-hmm. So that's the difference to begin with. Okay, so I see there is a disturbance there. And yes, let me just tune in here. So there I am. Okay, so I'm in this area now. I don't necessarily go to the affected area, but since this is a demo, and I'm just going to go right to the affected area, and I'm going to get into S1 right now, and I'm going to send energy there. Now, I have been told that it's like a laser. So for want of a better description, let's just say that I am sending you energy into S1 as if it were a laser. Now, it shouldn't be intrusive. It should be very pleasant. People can feel all kinds of things, from relaxation to reduce pain to, a warm feeling. But let me just stay with S1 for a moment, because even though you said L5, was it?
L5, yeah, right where L5 and S1 come together.
Yeah. So I think S1 is more of the culprit. So I'm in there, and I'm sending energy to that spot. And let me continue. So you want to know what my process is. Okay. So now I'm sending that energy, and I can see that your body is receiving. So that's another thing. It's not just seeing and sending, but it's having the body receive. So you're doing very nicely. So S1 is responding in a very positive way. And rather than to jump to L5, I'm going to just stay with S1 because I think for you, that's where I need to be. All right. Now, do you have pain radiating down your legs, or it's just your lower back?
No sciatica. I haven't had that for decades, but I can say that I don't know if this is relevant, but I do feel sensations in that area.
As I'm working on you, right?
Point. Pardon?
Yeah.
Yeah. Absolutely.
It's very relevant. It's very relevant.
Yeah, I do feel sensations, kind of coolness, and then yeah.
Okay, so it's very interesting. And another point, it happens very quickly. It happens very quickly. I mean, I think, as soon as I tune in, it starts to happen. So it happens very quickly. We don't have to, have an agenda for it to happen. We just have to have the intention. All right. So now I'm still in S1, and I love what's happening because the area around S1 is really being infused, and it's almost as if I'm going to say about the size of $50 around S1 is really receiving very strongly now. So just give me a moment, and I'll continue to do that. Oh, Michael, this is good. Very good. Very, very good.
I have a receptive system. Am I receptive?
You do.
Am I receptive?
You are.
It's amazing. So some people are not receptive for some reason, or?
Let me explain that in just a moment, because I would just want to
right.
tune into this. First of all, may I have some feedback? How does that feel now?
It feels great.
No pain?
Well, I'm standing up, stretching just a little bit.
All right.
And it feels good. It feels really nice, actually.
So it feels different.
Yeah, it does feel different. I get a hitch, what I call a hitch in the giddy up when I stand up or from a sitting position after a while. I walk every day, but I do sit for long periods at my desk. And I could say there was a little tightness down in that area.
And do you still feel it?
Slightly a little bit. I've been sitting here for a little while.
Are you still seated, or are you standing now?
I'm standing right now.
However, just stay put for a moment. No. Stay put for a moment.
Don't sit down.
Because we're putting like the finishing touches on this.
Okay.
The icing on the cake. All right, here we go. So you're going to see this comfort come to you in just a moment. Yeah. So this is frequent. After I work on someone, we're almost there, but there's a little nagging whatever, and it doesn't take long to deal with that last little bit. Just give me another moment. Oh, yes, Michael. All right, now tell me how you feel.
I feel good.
So did we get that nagging little thing?
It feels really nice. Yeah, we got that nagging little thing. Do we have any response from the muscles around that area?
Hold on.
Usually, or
are you saying that you don't have the nagging response? Correct.
Yeah, I don't have the nagging response.
Okay.
Yeah.
Okay. And now, what is your next question?
About because the muscles around that area have a tendency to get tight, protective-like, sort of in a protective way.
Oh, that may go by the wayside because it was S1 that really was the culprit. So this is a good point. Thank you. So we worked on the area that needed attention. Right. And so if you're concerned about your muscles, it could be that they become a moot point because that was not the original insult. Yeah.
Good point. Yeah, that's excellent. Yes, thank you.
That's fantastic.
Feels great. I'm going to go out and I'm going to take another walk when we get done. Excellent. No,
okay,
it really feels
so
good.
I
want to. It really does feel good.
Okay. So, listeners, can you hear that? It really feels good. Now, I have to give Michael some instructions. I want that to integrate in your body, so no deep tissue massage tonight. Nothing real strenuous for at least a half hour, and then if you want to walk or whatever, fine. But you see, we've worked so quickly on these cellular changes, and it needs to integrate into the body. So that's why
that was the question I was going to ask. Is obviously, you don't do any other modality until this is kind of taken, so to speak. It would be the term that I would best comes to mind.
And it doesn't take forever. Within a half hour, you would be, what we've done would have integrated into your body.
Mm-hmm.
That's excellent. That is nice.
Well, I would think too.
Thank you.
I mean, are you feeling more relaxed, Michael? I mean, how would you describe the overall sensation in your body? Do you feel like
I have more flexibility? Yes, I think that part of my body is more relaxed now.
That's great.
I mean, I'm very attuned to what's going on down there ever since, and I don't overdo it. However, when sometimes when I'm playing golf, I feel it. Other times, I don't. But eventually, I will somewhat feel it if I'm not playing for 4 hours. It could come all of a sudden where I kind of like get a little hitch and the like. But it feels very good. It feels wonderful, actually.
Right.
And I'll be certain to send you an email.
Well, I'd appreciate that.
You know.
Now, Michael, I'm tuning in further. So golf, you have a passion for golf?
Oh, yeah, absolutely.
Okay, so...
I used to be able to play 36 a day for 4 days, but that's not happening.
Okay. So, Michael, is there a professional that... Here, let me just tell you what I'm seeing, and you can figure out what we need to do with it.
Mm-hmm. Mm-hmm.
Your stance doesn't support you well. So you either need to be a few inches further apart, your feet, or, I think that's what it is. So the stance needs to be adjusted a little bit, and that also will help with your back. So I've worked with so many athletes, and I'm able to get into their endeavor and make corrections or suggestions about how to improve very basic things. And in your case, Michael, get someone to look at your stance. I think it just needs to be a few inches wider than what you've been doing.
Okay.
But I could be incorrect, but I think I am correct.
That's the way to say it.
We're going to trust you.
The affirmative.
Yeah. Yeah. See if you can find someone, who really can observe that. And so what I'm saying, I'm seeing you, with your feet separated. You want your SI joints to be parallel. So when this person observes you, please ask that person to let you know if one side appears to be higher than the other, just when your feet are separated. Okay?
Mm-hmm. Absolutely.
Did I make that clear? Yeah. Okay.
Yeah.
Okay.
Oh, perfect.
Right.
Thank you.
And then send me an email.
And then send her an email.
Then I'd see. I want to get back out and do that. I'll let you know after this Sunday. I just booked the tea time. So between the lower back, the S1, and the stance, which I'll go to him for, we'll work on it.
Wow.
And luckily, I live on the golf course, which is nice.
Yeah, no, that's
to be able to experience that. It's interesting. I want to ask you a quick question about horses, because I know that you've worked with horses. And unfortunately, we had to put my girlfriend's warm blood, 18-hand warm blood, down a couple of years ago. However, there's something, and she lost 2 horses from foundering. 2 horses, not 1, but 2.
Yes.
Yeah, yeah, and prime animals that weren't that old, and subsequently she's kind of reticent about getting another horse between that and travel and stuff. But it is a passion of hers, and I just wanted to know if you've worked with horses with that particular affliction.
Yes,
prior
I have.
To, I guess. Yeah.
Yes, I have.
The University of Florida not the University of Florida, the vet who came over and helped out with the horse had said that a small colic intestinal blockage in the small intestine happened to be one of the underlying factors for the eventuality of foundering. And I keep thinking to myself, well, obviously I wish I'd known about you 2 years ago. I would have definitely given you a call, had her give you a call. But could you kind of speak to that a little bit with regard to what you've done with horses, or whether anything along this line of foundering? It's a big problem now.
Yeah, I know. Well, I'm just thinking of a horse that I worked on, that was supposed to be a hopeless situation. It wasn't hopeless at all. I just worked on the horse, and the vet was astonished, and end of story. But the causation, I can't say. Causation?
Yeah, right.
I don't know. Now, does she have a passion for these large animals? I mean, would she be unhappy with a smaller horse?
Dressage rider. She's a dressage rider.
I see.
And she's had many warm bloods because evidently they make some of the best dressage horses.
Yeah.
Now, not to say a good friend is a pony who has become very good at dressage. However, I guess that's just been her preference throughout her career.
Right. Well, they're so beautiful.
Mm-hmm. Oh, gorgeous! Yeah.
So I'm not sure I'm answering your question, whether there was an intestinal blockage that was, contributing to this condition or not. I can't.
I'm not asking you to make a judgment. I'm not asking you to kind of make a judgment with regard to that. But when you come across a horse that's got a foundering issue, the process is exactly the same as what you just did with me. Am I correct? Or is it different?
No, I would say it's very similar. It's very similar.
All right.
It's very similar.
And I would make a guess that you'd have to kind of get to the horse as quickly as it's identified, or is there something that is it an issue of timing?
Not necessarily. Not necessarily, because you can try so many different things that don't work.
Yeah.
And
good point.
Yeah. Right. So I would have to say not necessarily.
Interesting.
Yeah.
Well, if you want, go ahead.
No, I just wanted to share something that is sort of a distinction I wanted to ask Dr. Gloria before we signed off. But while you were working on Michael, I will say that even though I do not have that physical problem, I felt what you were doing, and I felt very relaxed and very calm, and also that sense of wholeness. Actually, maybe a little bit of that heaviness that you were talking about. My legs are like, wow, I just so relaxed. So do you find that when you're working on somebody and there's somebody else around, that they also receive the benefits of your healing?
Yes,
the healing energy?
I do. Yeah, most definitely. I'll tell you a funny story. So I had a friend that had a little terrier that was a yapping terrier. And
I know those.
They do that. At any rate, I worked on her, and the little doggy fell asleep. So much for yapping.
The dog felt so relaxed. Yeah.
Yeah.
No, I mean it's a beautiful gift. I mean it's just I just feel so at peace. So I want to thank you for my healing as well.
You're welcome, Lisa.
Yeah, no, it's interesting because and I know and this might sound funny, but I was having a little bit of a pain in my one toe. I thought, where's that coming from? And then as I was getting ready to do the show, I thought, well, maybe I'm meant to have this challenge so that Dr. Gloria can work on it. But I'll tell you, my toe feels good, even though it was funny. I guess you weren't working on me, but I received the energies, and I'm so
right. And that's That's a good point, Lisa. The energy will go where it's needed. Yeah.
That's what
it's
you said
amazing.
initially too. Yeah.
Yeah, it's amazing. I will share that with you because I thought I don't remember stubbing my toe. I don't remember doing whatever, but I can tell you now I can bend my foot without that pain in the toe on my right leg. It's so interesting. So it is so beautiful, and I want to just say that I truly believe that the energy that comes from your heart is the whole package, Dr. Gloria, because you are so heart-centered, and everything that we talk about on this show is about being connected to love, and you really exemplify that. And I'm just so grateful that you're able to join us here, and I hope that you're able to come back again. Is there something that you want to share with our audience that you feel is really important and I guess critical at this juncture on the planet that you think that may benefit those our audience listeners?
Well, yes, I would like to say, and Michael, thank you for being such a good subject, such a good Healy. But anyway,
I'm a great Healy.
You're a great Healy. It works quickly. There's not too much of a decision to make. You just text me, as I said. I'm not hard to reach. Sessions usually last 50 to 60 minutes, and I like to do a package of 3. That's usually what's required, but sometimes, we just need 1 session. So I don't stand on ceremony, and I'm happy to look at all kinds of situations. Now, chronic situations that are misdiagnosed, undiagnosed, those kinds of things, I don't need a diagnosis. So if someone is suffering from some quote-unquote unknown malady, don't hesitate to contact me because the energy makes the corrections. Yeah.
Out of curiosity, should I connect with you about 2 more sessions, or?
If you'd like. We can scan your whole body and see what else is going on if you'd like. It's
there you
up
go.
To you.
No, I like that. I was going to ask you whether you did that. Just to kind of a scan if people kind of feel off or something's happening, but that's amazing. Yeah, I will connect with you. Is the phone number on your website yourself the cell number you're talking about, referencing?
As far as I know, someone Googled and a telephone number came up. So let me give you the correct one, okay? It's 805-701-0363. That's the correct one.
Perfect. All right. I'll connect with you about some more of that. I'm very much into prevention, but I've had the issue, no longer have the issues dissipating. And you've done a wonderful job. I sat down and I stood back up again, and it didn't feel the same way. I'll tell you that.
Good.
So
Yay.
Something happened. I'm going to go out to dinner here and do the same thing, but it feels a lot. It feels very much like there's been a release of something down there that's been locked up, and it's been released. That's what it feels like.
Yeah. And Michael, maybe for our audience, you can give us a report so we can post it on the Instagram so people can just tune into some of the changes that you've been experiencing.
Oh yeah, absolutely. I will, and I certainly by the first next week after my golf game, I'll make sure that I do that.
Yeah,
that's the one thing I do. So yeah, I will definitely get together with you. There's a couple of things. I'd love to have a scan and kind of get an idea of kind of what's going on.
Sure.
I do turn 65 in less than a couple weeks, so it's always a good idea for me too. Although I feel like I'm 40.
That's
I feel
good.
40, except for a couple of little tweaks here and there. But it's fun. So I thank you for being on.
Yeah, and I just want to, for our audience, just again, it's Dr. Dr. and then Gloria Kaye, KAYE.com. And your number is 701-0363. And there's so much to see on your website and so much more to discover. And I'm so grateful to you, Dr. Gloria, for joining us. And I want to thank you on my behalf and Michael's behalf. And I do hope that you will join us again here on Connect to Love.
It's my great pleasure. I would like to have your audience know that there's a free download of my book.
Yes,
on my website. Yeah. So you can get a better sense of what makes me tick.
Oh no, it's delightful. I just flew through it. I'm an avid reader, and I was so excited to see your book on there. And what a beautiful foreword by your daughter. I mean, it just it sums it up. But it's who you are, and you really are truly a gift in so many people's lives, and I was so honored that you could join us here.
Oh, it's my pleasure.
Thank you.
And anytime,
you're amazing.
God bless the two of you.
We will have you back. Let me think what's going on.
Yeah.
Thank you.
Yeah, and I usually let Michael close out the show. Anything else you want to add, Michael?
Miraculous. That's all I can say.
Miraculous. That's beautiful.
Young lady.
You are. Yeah. Thank you.
All right.
Thank you, Dr. Gloria.
Until next week.
Oh, you're so welcome, and I thank you.
Thank you. Until next time, may you all be blessed.
Thank you.
Be well.
Be well.